We have a new article that's been published recently in the Journal of Bone and Joint Surgery that I was intending to talk about today. The study looks at clavicle fractures and discusses whether surgery is always a great idea. They looked at about 117 patients, and they treated about half of them with a figure-of-8 brace, which is a sling you wear around your shoulders that pulls your shoulder blades back and holds it in place to keep the clavicle still while the fracture is healing. They also operated on half of the patients and compared the results at several time points after surgery. For the most part, people did pretty well regardless of whether they had surgery or not, but they did find that patients who did not have surgery and were treated with the sling had a greater likelihood for the bone not to actually heal back together. And this model shows the clavicle, sort of like it's sitting in your shoulder. And the fracture that we're talking about occurred right in the middle of the clavicle here, and the two pieces were separated. What we found, or what they found in the study, was that in patients who did not have surgery, there was a higher risk of the clavicle not actually to heal back together, and we call that a non-union. And the patients who had a non-union, some of them actually did go on and have surgery to fix that non-union. The other thing that they found was that without surgery, the clavicle was shortened, where the ends of the bone, instead of being right together or at the same distance apart, they would overlap a bit. And what that does is it results in the shoulder being further forward, and often we call this motion depressed, but further forward and depressed. And that can have implications in future activities such as throwing and reaching and lifting, especially lifting overhead. And for some patients that may not be an option. Overall, the results were pretty equivalent between the two treatments, and for most people it's probably okay not to have surgery on a midshaft clavicle fracture.